First, I would like to thank organizing committee, host and co-host of this program to provide me this opportunity. Hello dear students, let me introduce myself. My name is Dr. Rsyn, Associate Professor, MIT University, Madhya Pradesh, Gwalior, India, and also Vice President, International Graduate Women in Science, USA. Today, we gathered here for celebrating Antibiotic Resistance Week, also known as World AMR Resistance Week. It is celebrated from 18 to 24 November every year. The purpose of this global campaign is to raise awareness and understanding of antimicrobial resistance and promote best practices to reduce the emergence and spread of drug resistance. So before proceeding further, we must know about what are antibiotics. So anti means against and biotic means life. Antibiotic is a compound or a drug which are used as a medicine to help or to stop the infections caused by the bacteria. They do this by killing the bacteria or by keeping them copying themselves or reproducing. Some examples of antibiotics are ciprofloxacin, doxycycline, penicillin, tetracycline, amoxicillin, avibactam, thiamethoprim, etc. This antimicrobial resistance occurs when microbes evolve mechanisms that protect them from antimicrobials, which are drugs used to treat infections. This resistance affects all classes of microbes, including bacteria, then known as antibiotic resistance, viruses, then known as antiviral resistance, if protozoa, then known as antiprotozoal resistance, and if fungi, known as antifungal resistance, etc. Together, these adaptations fall under the AMR umbrella, posing significant challenges to healthcare worldwide. So resistance is exposure to bacteria occurs, how infection occurs and the bacteria spread, and drug treatment is used. So in this diagram, you see two phases, non-resistance bacteria and drug-resistant bacteria. So in the first one, the bacteria multiplies and by the drug treatment it dies and the person is healthy again. But if drug resistant is there, if drug resistant bacteria is there, the bacteria multiplies and the bacteria continue to spread and the person remains sick. So when should you not use antibiotics? Only bacterial infections can be killed with antibiotics. The common cold, flu, coughs, bronchitis infections, sore throats, stomach flu, they all are caused by viruses. So antibiotics won't work to treat them. Your doctor will do test before deciding whether an infection is a viral or it's a bacterial, and then prescribe the antiviral, viral or any other medication. What conditions do antibiotics treat? Some type of infections that can be treated with antibiotics are like some ear and sinus infections, some dental infections, skin infections, strep throat, bladder or kidney infections, bacterial pneumonias, etc. So, antibiotic resistance. Antibiotics are powerful germ-fighting tools when used carefully and safely, but overuse has led to the antimicrobial resistance. Bacterial adapt over time and become superbacteria or superbugs. They change so that antibiotics no longer work on them. They pose a big threat because there aren't any medicines to kill them. So these microbial infections affect millions of people worldwide. These infections are transmitted through microscopic single cell spores that can survive for long periods of time outside of a host, lying dormant in soil, air and water. Microbial infections are a serious problem in healthcare settings, and antimicrobial resistance has emerged as a major challenge for current medicine and healthcare system. As antimicrobial drugs are used to treat the microbial infections in humans, animals and crops. So important point from previous slide is antibiotic resistance. Overuse or misuse of antibiotics developed antibacterial resistance, and WHO, that is World Health Organization, recognized this as one of the major problems. What causes antibiotic resistance? Over-prescribing of antibiotics. So inappropriate use of antibiotics can cause side effects such as allergic reaction, digestive issues and more severe conditions like Clostridium difficile infections. Another important point is patients missing their doses. So understand your medication properly. Don't miss the dose. If you missed it, then take the missed dose as soon as possible. Taking care of that, do not double up. Consult healthcare providers and use reminders so that you will not forget your medication. Next point is overuse of drug in fish farming and livestock. So antibiotics in fish farming create resistance and are an animal welfare disaster. Fish farming is an underappreciated source of antimicrobial resistance, and as a global citizen, we can no longer neglect ecological and human impacts. Next is poor infection control in hospital. So inadequate hand hygiene, improper sterilization, lack of adherence to protocols and impact on patient safety. These are the reasons. The next is taking antibiotics when not needed. It accelerates the emergences of superbacteria. What are superbacteria? The microbes resistant to multiple drugs are termed multi-drug resistant and are sometimes called superbugs. Overuse can make bacteria resistant to drugs and making modern medicine useless. It is the bacteria itself gaining immunity. When bacteria become resistant to antibiotic, common infection will not be treatable, that is incurable. Antibiotic resistance affects all age, gender and country. This problem of antimicrobial resistance, infection lead longer hospital stay, more medical bill and even more death. So the best way to help slow the spread of superbacteria is by being smart with antibiotics. Here's how. Only take once your doctor has prescribed for you. So take them as directed by qualified healthcare professional. Don't skip doses. Take them for the full number of days your doctor prescribes. Never save them for later. Trust your doctor. If they say you don't need them, don't take them for an infection. So let's pledge to use antibiotics responsibly, promote awareness, practice proper hygiene, and encourage innovation. By taking this pledge, I commit to being a steward of health, safeguarding the effectiveness of antibiotics for future generation. Thank you. Thank you for hearing me with patience. If you have any query, you can contact me at bhadaria.raman@gmail.com. To keep updated, kindly visit rsyn.org, or even if you have any query regarding your career perspectives in STEM, you can contact me on my mail. Best wishes for your successful career. Thank you and take care.